Hello and welcome to Askimo TV. I'm talking today to Dr. Elliot Sorene. Dr. Sorene is a consultant orthopaedic surgeon and specialist hand and wrist surgeon at the London Clinic. Hi, Dr. Sorene, how are you?
Yes, I'm very well. Good morning.
Dr. Sorene, let's talk today about carpal tunnel syndrome. What is carpal tunnel syndrome?
Carpel tunnel syndrome is an extremely common condition, which is when one of the main nerves in the hand, it comes under pressure in the wrist in an area called the carpal tunnel, and this can cause a number of symptoms and problems in the hand, and it can be a progressive condition. It's caused by a number of problems, including diabetes, endocrine problems, repetitive work with the hand, particularly with vibrating tools. It can come on after an injury. It can come on if there's a swelling in the area, and it's also related to inflammatory conditions.
What are the possible risks if left untreated?
If left untreated, in the short term, this can cause pins and needles, interfere with sleep, shooting pains in the fingers. The patient, it can interfere with their sleep on a daily basis, waking them up at night. And if left long enough, eventually the symptoms can be left permanent even after it is treated. So the patient can be left with permanent numbness in the fingers, and eventually if it's left for a very long time, it can actually get muscle wasting and weakness of the hand itself and start dropping things.
What are the signs and symptoms that I may have carpal tunnel syndrome and should perhaps seek medical advice?
The classic symptoms are that the patient will complain of pins and needles and altered sensations going into the hand, mostly in fact affecting the thumb, the index and the middle finger and half of the ring finger. But it can in fact affect the whole hand. It can just affect the thumb. There's no set rule, but classically it's more this side of the hand, the thumb side of the hand. It can cause pins and needles, shooting pains and a feeling of swelling in the hand. It will wake the patient classically at night. They'll shake their hand at night and try and find a more comfortable position. And eventually, if left long enough, the numbness means they'll have trouble doing buttons up, and eventually they may even start dropping things due to wasting in the hand.
How is carpal tunnel syndrome diagnosed, and what treatment options are available?
Carpal tunnel syndrome is classically diagnosed by a history. The patient gives the story, which we've just gone through. On physical examination, there are certain tests. Tapping along the length of the nerve can create these pins and needles, but the gold standard and the best method of diagnosing this is what's called a nerve conduction test, or EMG, when one does electrophysical testing and you measure the speed of the nerve and where the nerve is under pressure. The carpal tunnel syndrome is compression of the median nerve itself, which is the nerve that gives sensation to a large part of the hand and also power to the thumb.
And how is it treated if you do find that somebody has carpal tunnel syndrome?
Well, if they've got carpal tunnel syndrome, if it's very mild at the beginning, this can be managed with splintage, physiotherapy, and very mild symptoms can actually go away by themselves, particularly symptoms that come on in pregnancy, which I didn't mention before. That's a large cause of carpal tunnel syndrome. So if it's very mild, it can go away. Or if there's significant pressure on the nerve causing this problem, then the way to treat this is to do an operation to release the median nerve. This is a very, very small operation, which can actually solve the problem in the vast majority of cases.
Is it possible to prevent yourself from getting carpal tunnel syndrome?
Well, if it's mild and if it's at the beginning, then patients can wear splints at night, and there are certain physiotherapy techniques, but to be honest, there's no real way of preventing it. It's an extremely common condition.
And just to end off, who's at risk for getting carpal tunnel syndrome? Are some people more at risk than others?
The most at-risk patients are patients with diabetes, with thyroid disorders, with inflammatory arthritis such as rheumatoid arthritis, patients that work with heavy vibrating machinery on a day-to-day basis, So patients that had wrist fractures or other wrist problems in the past, patients with Dupuytren's disease, which is a condition associated with this. But once again, this is a condition which is endemic in the population. It's so common that pretty much everyone can get carpal tunnel syndrome.
Thank you, Doctor. Thank you so much for speaking to me today.
You're welcome. It's been a pleasure.